Thank you, Simon. Hopefully, you've got me online and Friday set up there. Um, Good morning and welcome, conference delegates, councillors, and QNMU staff. My name is Grant Burton. I am the Assistant Secretary Nursing. Unfortunately, I can't be with the executive team in the studio in Brisbane due to a knee injury, so I'm in Rockhampton on the lands of the Durrumbal people, and I'd like to pay my respects to the traditional owners of the land, elders, past and present. It's a pleasure to have you join us today for the Virtual Assistant Secretary's Conference presentation. Whether you work in public, private, aged care or diverse areas, this session aims to bring us together to hear about an important topic, one that we all face, being someone should do something about that. We are that someone, advocacy, action and ownership in nursing and midwifery. And we look forward to an engaging and productive session together. But before we get on with the presentation, it is my pleasure to introduce you to the new and first for the QNMU, the Assistant Secretary Midwifery, Ms. Fridae King. Fridae.
Thank you, Grant. Good morning, conference delegates, councillors and QNMU staff. As Grant mentioned, I'm Fridae King, and I want to express my gratitude to all the members for elevating me to this historic role as the first Assistant Secretary of Midwifery. I am dedicated to empowering members to tackle local issues and advocate for impactful social and political change. I am deeply committed to fostering safe and supportive maternity environments for all of our members, women, newborns and families. And I am passionate about workforce sustainability, work-life balance strategies and innovative models of care. As we look toward the future of the Queensland Nurses and Midwives Union, I am deeply passionate about making sustainable decisions that not only benefit our professions, but also support the well-being of our members. Together, we can advocate for practices that are environmentally responsible, socially equitable, and focused on the long-term health of both our workforce and the communities we serve. What excites me about this journey is the unity we share as an executive team. Each of us brings unique perspectives and expertise from our respective areas, and it is this diversity that strengthens our collaboration, and I believe that by working together, we can harness our collective knowledge to address challenges and innovative solutions that resonate across all nursing and midwifery. I am particularly looking forward to getting to know you all and connecting with our members and local midwifery and nursing and carers activists. Thank you once again for this opportunity. I am excited about what we can achieve together as we move forward in unity and purpose. Let's make a positive impact for our professions and the members. So Grant, what are we going to talk to the delegates about today?
Well, Friday, we want to talk about something I think we've all witnessed and heard, and maybe even said ourselves at some time in our working lives, being someone should do something about that. So, delegates, Friday and I are going to attempt a bit of a role play, which we hope many of you will relate to or may have seen at some point. So let me set the scene for you. You're in the tea room on a break. No, hang on, scratch that. Unfortunately, breaks can be a rare occurrence, so no, we won't do that. Picture you're leaving your shift late, walking to the car with another colleague. Friday, what a busy shift, hey? Have you seen how many double shifts people have been doing lately? It's getting out of hand.
Everyone's exhausted, and mistakes are bound to happen at this rate.
Yeah, I agree. Someone should really do something about that. That was really simple, but I think we've all seen or heard something like this. So let's do another example Friday to see if everyone can relate to. I just saw the roster for next week. We're short staffed again for the night shift. That's 3 weeks in a row.
Oh, I know. It's getting unsafe. We're barely covering the basics, let alone giving proper care.
Someone should really do something about that. It's just not right.
Yeah, maybe we're that someone. If we don't speak up, nothing's going to change.
You're right. Maybe it's time we raised it with the line manager or even the union to see what we can do. We can't keep burning ourselves out. If we're feeling this way, then I suspect our colleagues are too.
Oh, seriously, whether it's about workloads, culture, or burnout, it's a common phrase. But today, we're going to challenge that idea because we are that someone. We work in one of the most challenging professions, emotionally, physically, ethically. When things go wrong or when conditions aren't safe, people say, it's not right. Someone should do something. But here's the truth. If we, as nurses and midwives and carers, don't step up and speak out, no one else is going to do it for us. This presentation is about owning that responsibility, not just for the patients, clients, women and newborns, families and communities we care for, but for ourselves, our professions and each other.
We know how to care, everyone. We're trained to put others first. Nurses, midwives, along with carers, are uniquely skilled in the art and the science of caring. With compassion at the heart of our practice, I know you all bring not only the clinical expertise, but also empathy, advocacy, and a deep understanding of the physical and emotional and cultural needs of those who you support. Your ability to connect, listen, and respond with kindness ensures that care is not just delivered, it's genuinely felt. But we need to match that same energy caring for others in caring for ourselves and each other. So to truly uphold the values of our profession, we must recognise that care goes beyond the clinical tasks. It means prioritising our own well-being, supporting our colleagues and creating a culture where respect, compassion and safety are lived every day. But caring, it also means having the courage to speak up when something isn't right. Using our knowledge, experience, and professional judgment, we have both the responsibility and the right to advocate for safe staffing, fair treatment, ethical practice, and supportive workplaces. Speaking up, it's not an act of conflict, it's an act of care. It protects our patients, safeguards our peers, and honours the integrity of the profession we belong to. So caring for ourselves and each other means standing together, informed and empowered, because that's how we create the kind of system we are proud to be part of. So that means knowing our rights, being aware of your entitlements, and being prepared to speak up when something's not right. Standing up is not just personal, it's professional and ethical. Far too many nurses, midwives, and carers, our colleagues, are uncertain about their basic entitlements. And it's no wonder, because we are so busy getting the job done that we do not have the time to think about this for ourselves. Safe staffing levels, correct pay classifications, entitled meal and rest breaks, on-call conditions, local workplace agreements. These aren't just bureaucratic terms, they're the foundations of safe, sustainable, and fair working environments. They protect your physical health, support your mental well-being, ensure that you're respected and valued for the role that you bring. But navigating these systems can be overwhelming. The complexity, the lack of clarity, and inconsistent communication have left too many feeling isolated, unsure, and unheard. That confusion is not your fault, but the consequences are real. When we don't know our rights, when we hesitate to raise concerns, when we're unsure, we stay quiet. And when we're silent, unsafe systems are allowed to continue unchecked, putting both staff and patients at risk. This has to change, everyone. Knowledge is power. Clarity builds confidence, and your voice, all of you, is the catalyst for this change. So let's reject silence and confusion. Let's stand together to demand transparency, share the knowledge, and empower every nurse, midwife, and carer to not just know their rights, but to act on them. Because when we speak, we don't just protect ourselves, we protect each other. And remember, and I can't stress this enough, silence is what allows unsafe systems to persist. Look, our rights and entitlements as nurses and midwives and carers aren't vague or optional. They are clearly outlined in several formal sources, each of which plays a critical role in shaping your workplace conditions and protecting both you and your patients. So this is a bit of a brief overview of some of those. Enterprise agreements, or EAs. These are negotiated agreements between employees, often through unions like the QNMU, and employers. They outline specific terms and conditions of your employment, such as your pay, your working hours, leave entitlements, rostering, and staffing provisions. Your EA is tailored to your workplace and it is legally binding. Awards. So these set out the minimum standards for pay and working conditions across entire industries or occupations. Even if you are covered by an EA, awards still form the safety net that can't be undercut, though we know employers try. Professional codes. So your registration as a nurse or a midwife, it comes with a professional responsibility, including obligations under the Code of Conduct, ethics, and practice standards. These not only guide safe, respectful care, they also provide a framework for what you should expect from your employer and colleagues in terms of professional treatment and accountability. And I know every one of you online today, more than recently, when you did your ARPA registration, you stopped and you read all those codes of conduct before ticking the boxes and renewing your licenses. Legislation. So national and state laws protect your workplace rights, including workplace health and safety, anti-discrimination protections, leave entitlements, and fair work principles. Knowing your legal rights gives you the confidence and the leverage when something doesn't feel right. Union support and advocacy. Unions, QNMU, we provide education, support, and representation. They help you understand and interpret the above instruments that I've just read out. They offer advice when you're unsure, and we stand beside you when you need to raise an issue, escalate a concern, or drive systemic change. These aren't just technical documents or background policies, everyone. They are the foundation of ethical, lawful, and safe care. They safeguard your ability to work safely, be paid fairly, rest adequately, and provide the best care possible without burnout or risk, which I know a lot of you can relate to at the moment. When you know your rights, you're not just protecting yourself, you're upholding the standards of our profession. You're ensuring our patients receive safe care, your colleagues are supported, and your workplace operates with integrity. So, read your enterprise agreement. Understand your award coverage, familiarise yourself with your professional codes, and learn what legislation protects you. Because knowledge gives you power, but using that knowledge, that's what gives you the influence. Sometimes raising concerns is unfairly labelled as being difficult or negative, but let me be absolutely clear. Advocating for what's right, it's not negative or being difficult, it's a strength. And I know it's one that each and every one of you possesses. Think of it this way. We advocate fiercely, relentlessly, and without hesitation for our patients, our residents, women, and those in our clinical care every single day. We speak up when something's not safe, when care is compromised, or when someone's well-being is at risk. That same fierce advocacy, we owe it to ourselves to speak up for each other and our profession. Because when we remain silent about missed meal breaks, unsustainable rosters, or unsafe staffing ratios, we absorb the harm it does instead of challenging it. And that is not okay. It takes moral strength to speak the words, "This isn't right." And it takes courage to challenge systems and norms that have been allowed to continue for far too long. But when we do, when we find our voice and we use it, we start to shift the ground beneath us. Speaking up isn't the problem, everyone. It's the beginning of change.
Speaking out alone can feel intimidating, especially in rigid hierarchies, close-knit teams, or workplaces where challenging the status quo comes with risk. It's easy to feel isolated, to wonder if it's just you, or to hope that someone else will step in. I am sure many of you are aware of Count the Babies campaign. This campaign involved midwives counting the number of mothers and newborns that were in their care. These newborns were not acknowledged as qualified patients and therefore were not included in the workload of midwives. But do you know how it started? Well, it all started with a notice of motion to conference, with members speaking out and the recognition by a local branch that there was a problem being faced by members that needed the full force of the QNMU to resolve. But it didn't pass on the first motion. It took many years of advocating, campaigning, and collective action from our members. The Count the Babies campaign, like all our campaigns, takes time to get the end results we wanted. We needed to gather the data, build the evidence base. Midwives and QNMU members engaged in forums, research, and media to raise public awareness and build community pressure. From there, we were able to put the pressure on key stakeholders in government to achieve change. But we got there, and thanks to midwifery members around Queensland stepping up and working together to make their voices heard. In particular, our Toowoomba members, their motion started this journey. Midwifery ratios represent a landmark advancement in our healthcare system, aimed at elevating the quality, safety, and dignity of care provided during childbirth. By ensuring that each midwife is responsible for a manageable number of women and newborns, we strengthen the ability to deliver personalised, timely, and emotionally supportive care throughout pregnancy, labour, birth, and the postnatal period. For women and their families, this means reduced clinical risks, more continuity in care, and greater confidence in the birthing experience. Midwives can better anticipate and respond to complications, provide clearer communication, and offer emotional support, especially during vulnerable moments. For families, it fosters trust and empowerment, allowing partners and support networks to feel engaged, informed, and reassured in the process. As of the 1st of September 2024, the amendments to the Hospital and Health Boards Act 2011 came into effect. From this date, every newborn who stays on a maternity ward with their birthing parent will officially be counted, or was officially counted, as a patient in our healthcare system. These amendments also coincide with updates to the Hospital and Health Boards Regulation 2023, which established clear guidelines to midwife-to-patient ratios. These legislative amendments mark a pivotal moment in maternity care. They are not just policy updates. This is a system-wide acknowledgement of the critical role that midwives play. These changes aim to prevent burnout among clinicians, encourage retention of skilled staff, and ultimately build a stronger maternity workforce. The legislation and regulations are critically important, but also quite hard to convey in a short presentation. For those who are keen to dig deeper, a copy can be found online. Achieving midwife-to-patient ratios is a crucial step towards maintaining high standards of care. The rollout will begin in CSCF 5 and 6 facilities, where these ratios will be implemented in stages. For these facilities, the ratios will be 1 to 6. This means no midwife will have more than 6 patients, and babies are counted in this ratio. The rollout of ratios will be continued throughout Queensland health facilities over time. As the benefits of midwifery ratios are shown, including the improvements in the safety of mothers and newborns, this will set the precedents for the private sector. Can I get a show of hands or thumbs online, or however you can do it from your seating arrangements in your watch parties? How many members are aware of the recent maternity addendum update for the Queensland Health Business Planning Framework? The recent maternity addendum update highlights the importance of managing workloads not just for mothers but also for their babies. This document outlines appropriate staffing requirements based on acuity and care. It is essential that we socialise and educate ourselves and our colleagues regarding the use of this addendum. It is imperative that we ensure safe workloads at every level of our health service, and this is an essential framework for us to use. These changes are especially important for maternity sites that currently lack legislated ratios. Here, the notional ratios from the business planning framework will be applied, providing a necessary foundation for care in these areas. As we strive to expand our services into CFCF level 3 and 4 regions, this initiative is a work in progress, but one that we are committed to achieving. So I encourage all of you to engage with the updates now live on the Queensland Health intranet, as this information is vital for us to navigate these changes effectively. So as you can see, when we act collectively through our union reps, our campaigns, our coordinated workplace action, something shifts. Our voices become stronger, louder, impossible to ignore. It's no longer a hesitant, someone should do something. It becomes a confident, collective, we are doing something. That's the power of professional solidarity. It gives us the courage to speak up, the strength to act, and the momentum to make change together. This isn't new. From Florence Nightingale and Ina May Gaskin to modern-day unionists, nurses and midwives and carers have always stood up, spoken out, and fought for safer care, better conditions, and the dignity of our profession. We are part of that legacy. We walk in the footsteps of generations who refused to stay silent in the face of injustice, who knew that advocacy isn't optional, it's essential. The changes we push for now, the improvements we demand, will shape the workplaces, the care models, and the lives of those who come after us. And we owe it to them and to ourselves not to accept the unacceptable, because silence enables harm. Because what we walk past today, the next generation will be forced to endure tomorrow. And because we know through history and through our own lived experience, real change only comes when we choose to be the ones who make it happen. Let's take a moment to focus specifically on midwifery. Midwifery care is holistic, continuous in nature, and grounded in an understanding of the social, emotional, cultural, spiritual, psychological, and physical experiences of women. But systematic pressures, understaffing, burnout, limited continuity models undermine these principles every day. Midwives often juggle acute and community demands, face long periods of on-call and overtime, and witness rising intervention rates. Yet midwives are uniquely positioned to advocate. Midwifery care is not just biological, it's social, political, and deeply human. Advocating for women-centred and evidence-based maternal health care means advocating for yourselves. What does that mean? Protecting continuity models of midwifery, speaking out on unsafe workloads, defending scope of practice, and supporting each other in this deeply relational work. Midwifery advocacy isn't an add-on, it's part of the calling. So what does advocacy look like? It can be big or it can be small. Sometimes it's speaking up in a staff meeting about a policy that doesn't serve women, newborns, and their families. Sometimes it's advocating for a woman's birth preferences when when systems default to intervention. It's mentoring an early career midwife or nurse, or debriefing after a hard shift, or supporting a student to find their voice. Advocacy is also collective. When nurses, midwives, and carers come together through professional bodies, unions, collaborative networks, we amplify our voice and protect our professions. And that's never been more important. We know the evidence. Continuity models improve outcomes. Midwifery-led models work. And culturally responsive maternity care matters. Yet these are not the default. So advocacy also means persistence. It means not accepting this is how it's always been, and instead asking, what do our communities deserve? It means reminding decision makers that cost-cutting and short-term fixes don't build safer, stronger systems. It means refusing to be invisible in the places where policies are shaped. Midwives, nurses, and carers are at the front line of life-changing moments. They experience joy, fear, transformation, grief, elation, and milestones. You hold stories, trust, and truth. Advocacy involves leveraging lived experience to drive change, not only within hospitals, communities, or homes, but also at the decision-making table. So let's keep showing up. Let's be fierce in our care, firm in our truth, and generous with each other. Because when midwives, nurses, and carers advocate, whole communities benefit. I would like to share some of my own story as it is truly inspiring and highlights the profound impact of union activism. When I first embarked on this path, I was very naive about the importance of professional indemnity insurance. The moment I realised I didn't have it, my shiny new early career midwife self was shocked into a state of fear and injustice. This experience was a massive wake-up call, revealing the crucial role of advocacy in our profession. I can tell you now that I have the strongest values around social justice, and getting involved with QNMU was a pivotal step that transformed not only my career but also my understanding of the power of collective action and how someone should do something about that. After my first year as a midwifery group practice midwife, I found my voice. But let's be real, I was always quite vocal about the challenges we faced. Me and our colleagues, we went to branch meetings several times. We completed multiple workload forms. We reached out to our local organiser, who just happened to be Grant, who's now the Assistant Secretary of Nursing. Grant became our trusted mentor at the time and guided us into discussions and disputes that were crucial for our progress. We then met Dr. Belinda Mayer, QNMU Strategic Midwife Research and Policy Officer. Since the day we met, back when I was a baby midwife, causing a lot of chaos in our regional maternity unit, she inspired me with her deep knowledge of midwifery profession and guided my inner research nerd, because I deeply love research. She helped me channel my rage for the system into a powerful tool through the mechanisms of the union movement. So I thank you, Dr. Belinda Mayer. As I became more involved with QNMU, I realised I had found my people. And the more I engaged, the more doors opened in new and exciting directions. A few years ago, I was invited to speak on an activist panel at an all-day mods event. Sarah, who was the Assistant Secretary at the time, you invited me and another delegate to sit at your table. And once again, us regional delegates felt lifted up and empowered by the movement. Every time we came away from union activities, we felt more empowered to do something. I am truly grateful to everyone in this movement who has aided my journey and allowed me the privilege to stand where I am today. Now we can keep the momentum going. We can all do something. My activism has not only enhanced my professional life, but has also positively impacted my colleagues and by extension, the community. We've created an environment where we can thrive, support one another, and prioritise the well-being of our women and families and the patients we care for. The importance of union activism in driving change cannot be overstated. It's a force that empowers us all to advocate for better working conditions, improved care, and a stronger sense of oh my goodness, this is a long speech. Thank you everyone for bearing with me. Solidarity. Strong sense of solidarity among midwives, nurses, and carers. In this ever-evolving field, we must continue to champion the collective efforts that lead to meaningful progress. When we stand together, we create a ripple effect that resonates far beyond our immediate surroundings, uplifting our profession and the patients, clients, women and newborns, families, and all communities. Let's carry this spirit of activism forward, knowing that each small step we take contributes to a larger movement for change, grounded in the principles of social justice. So where do you start? Get informed. Attend a QNMU education session. Read your agreements. Jump onto the QNMU CPD portal and check out our webinars and self-paced education. You can also get involved. Talk to your workplace rep or organiser. Join your branch. Attend the meetings. Put your hands up. Attend Labor Day and show up at these events or rallies. Get active. Support a campaign. Share your story. Show up. Like and share info from QNMU social media. You don't have to do it all, but just do something, because every step builds our collective strength.
Thanks, Friday. That's a hard one to follow, but I'll go through my reflection of my own journey now. So my journey into activism, and I come from a predominantly private hospital working background, it didn't start with a plan. It started with a deep love for caring for people. Now, I've always been driven by those powerful moments of holding space for patients in their most vulnerable times and witnessing incredible joy, seeing them recover and hopefully go home. That's what lit the spark. But what truly pushed me to step beyond the bedside was seeing something I couldn't ignore. I saw colleagues, good, kind, hardworking people, too afraid to speak up. pressured into doing overtime they hadn't agreed to, expected to say yes no matter their personal circumstances. I witnessed people being spoken to in unacceptable ways, intimidated or belittled just because someone with power thought they could. And all too often, the silence is louder than that injustice. So, with the encouragement of my nurse unit manager, I realised I didn't have to accept that silence and I could be someone who did something. So, I got involved. I educated myself through union training. I became an EB rep for my workplace. I became a workplace rep. I became a branch delegate. And then I was lucky enough to take that journey further and become a QNMU counsellor. I found my confidence in doing this. I found my voice, and eventually I was fortunate but very proud to take that further and actually work for the QNMU. And it's a privilege and an honour to be here now as the Assistant Secretary Nursing, along with Fridae, Sarah and their council and executive team. This work isn't always easy, but my passion and resolve have never wavered. I keep going because every step I take helps someone else find their voice. And now what drives me even more is seeing those who come after me stand taller, speak a hell of a lot louder, and carry that fire forward. They remind me always why I started and why I will never stop. So hopefully, and I'll do a bit like Fridae, give us a show of hands, wave your arms around. If you're willing to take that next step, if you're willing to not be silenced, to be heard, because next time you hear someone should do something about that, I want you to remember it might be you, and you are not alone. Together with knowledge, solidarity, and courage, we can and we do shape a profession that is respected, supported, and sustainable. Because when nurses and midwives and carers, however titled, stand up for themselves and each other, everyone benefits. So stop waiting, everyone, for someone else to fix your workplace. That change starts with you. You are all that someone. You are not powerless, and you are certainly not alone by who's in attendance virtually here today. Nearly 79,000 members. You're not alone. Every nurse, midwife, carer who speaks up, who asks questions, who supports a colleague or challenges the status quo, you are all part of something that is bigger, a collective force for change. We are the QNMU, everyone. We are here because of our passion and for this great profession. So when we stand together, informed, united, and brave, we stop accepting what's broken and we start building the workplaces that we all deserve. One that is safe, respectful, supportive, sustainable, fair, and importantly, values the work that we do. When we stand up for ourselves and each other, everyone benefits. So, again, Fridae and I challenge you all here today. Don't wait. Start stepping up. Start speaking out. Be the change and the voice for nursing and midwifery profession, and importantly, yourselves. So, that brings us to the end of this presentation. We hope you've just been a little or maybe a lot enlivened, which would be awesome, and be that someone who will do something. After the morning tea break, we will hear from a couple of activist members. Fridae and I will be hosting, and you'll hear from those members as to how they've started to find their voices, to challenge the status quo in speaking up and wanting to do something. So wholeheartedly, in solidarity together, thank you, everyone.